Hello again, everyone. This is Jonathan Wright, Dr. Wright, court of the University of Michigan anyway, from the Tahoma Clinic in Tukwila, Washington. Today's topic is going to be about osteoarthritis, a basic vitamin treatment. Now, I know there are many things that are sold in the natural food stores, online, in the Tahoma Clinic dispensary, your compounding pharmacy, many things that are used for osteoarthritis. But there is one very basic vitamin treatment that, in my opinion, and you'll hear why it's my opinion, should always be used. Sometimes, if it's used first, that's all that's needed. And actually, in a large majority of cases, that's all that's needed. No kidding. One basic vitamin for osteoarthritis. Now, what's osteoarthritis? Well, it's the type of arthritis that does come on, usually, quote, when we're older, unquote, although some people in their 40s actually start getting osteoarthritis. It's not inflammatory. The joints don't get inflamed. They just deteriorate. Yeah. And the range of motion of the joint might not be so good, and it hurts going up and down the stairs if it's in your knees or your hips, and if you get it in your fingers get stiff, but they don't get inflamed. And the doctor will tell you it's degenerative arthritis or it's osteoarthritis. And that's the type of arthritis that people have their knees and hips replaced about. Now, if you want to avoid that, if you're starting to get osteoarthritis, or even if you have it already, this basic vitamin is a must. Now, what is this basic vitamin? It's niacinamide. Notice I made emphasis on niacinamide, because that's not the same as niacin. Niacin will not work. But niacinamide, wow, what will it do? Well, of course, I'm here to tell you. You can tell I'm impressed. Now, what did I get impressed by? I got impressed by a book written by a Dr. William Kaufman. And if anybody wants to look that up, that's Kauffman, William Kaufman. Published in 1949, it was called The Common Form of Joint Dysfunction. He was referring to osteoarthritis, of course. Now, Dr. Kaufman actually started his medical career as a psychiatrist in the 1930s. And at that time, actually, there were a lot of people who were deficient in niacinamide and its cousin niacin, and they were getting some mental problems from it. And that's how he got interested in the vitamin, because using those particular vitamins, niacinamide and niacin, would help people with their mental problems. But some of those people told him, hey, my joints got better. That got him into studying degenerative arthritis, osteoarthritis. So this book describes his research on several hundred people with osteoarthritis. And he was a meticulous fellow. He actually designed some of the first instruments that would measure the range of motion of a joint. What's the range of motion? Well, how far can it contract? How far can it bend and extend and bend and extend? That's just range of motion. And in these several hundred people, he measured the range of motion of every joint in the body on every visit. I'm not kidding. The knees, the hips, the ankles, how far could they flex and contract, flex and return, and how far can your knee flop, and so forth. Why did he do that? He did that because he called that an objective parameter. And all that means is a measurable parameter that is not a psychological parameter. Because, of course, people could take a placebo and think they had less pain, but it's very unlikely they could take a placebo and increase the flexibility of their joints. So he certainly did have people keep pain scores, but he also measured the range of motion of their joints. All right, by the time he concluded his study, which was in 1948, and the book came out in 1949, he had enrolled several hundred individuals in this program. What he found, and really, folks, I am not kidding, is that with sufficient niacinamide, the very large majority of these folks, their osteoarthritis pain went away and stayed away for as long as they took the niacinamide. I'll get to quantities after a bit. What do I mean for as long as they took it? Well, Dr. Kaufman was a very careful scientist, and he'd have them go on it for long enough for all their joint pain was gone. In the very large majority, in my experience, it's over 90%. And they'd have them stop. and they'd stop. And guess what? All the joint pain would come back in 3 or 4 months. So you might be thinking, well, what's the good of that? Well, by the end of this, you'll be hearing what the good of that was. And then the pain would come back, and he'd have them go back on the niacinamide, and the pain would go away. By the way, should you try this for yourself, there is never any difference in the pain until the 3rd or 4th week of treatment. And then, oh, okay, it's starting to get better. By the end of the 3rd or 4th month, most of the people I've worked with, it's been over 90%, have said, I've got no more pain anymore. I'm not kidding. But if they stop, it comes back. So you can't stop. Oh dear, isn't there something that will actually cure it? Well, probably, but here's why the niacinamide is so basic. Since the year 2000, there have been 4 research studies published, of which I'm aware, that say that osteoarthritis, degenerative arthritis, should actually be classified as part of the metabolic syndrome. Osteoarthritis is part of the metabolic syndrome. Yes, I did repeat that. What's the metabolic syndrome? Why, that's prediabetes. Yes, high blood pressure, high cholesterol and triglycerides. A belly out here. Abdominal obesity, it's called. And that's all identified as the metabolic syndrome. But these 4 pieces of research found that in 80% of individuals with osteoarthritis, if they did the appropriate test, sometimes it was a fasting insulin, sometimes it was another type of test called C-peptide, if they did the appropriate test, that 80% of people with osteoarthritis were pre-diabetic, which means they happen to be in the metabolic syndrome category. Now that's 80%. That's not 100%. I've got to agree. But even so, 80% were pre-diabetic. All right, so what has that to do with anything that osteoarthritis is part of the metabolic syndrome? There is lots of research going on right now that's pointing to one of the causes of type 2 diabetes, this is type 2, not type 1, has to do with a malfunction in the mitochondria in an area that is dependent on niacinamide for its action. It's a mitochondrial part called NADH, niacinamide adenine dinucleotide with a little hydrogen attached, and that's the NADH. And malfunctions in this niacinamide, what shall I say, niacinamide is a precursor of this particular NADH. Malfunctions in that are thought to have a lot to do with type 2 diabetes. And there's other research that shows that niacinamide directly stimulates the pancreatic islet cell stem cells to turn into new pancreatic islet cells. Wow, does that have to do with type 2 diabetes? And mostly type 1 diabetes. We could actually think about rejuvenating, dying off pancreatic islet cells. Well, what about type 2 diabetes? Those pancreatic cells are under a lot of pressure to keep performing, and if niacinamide will help the pancreas make new islet cells so it can keep performing, gee, niacinamide involved in getting type 2 diabetes from the mitochondrial point of view. Mitochondria, remember, are the little energy engines inside of every cell that turn out ATP. That's the energy molecule. And if niacinamide is a key part of that, I'm sorry, if the enzyme that niacinamide turns into, or the molecule that niacinamide turns into, I stated that wrong, called NADH for niacinamide adenine dinucleotide hydrogen, if malfunctions of that has to do with type 2 diabetes, and if niacinamide also stimulates pancreatic islet cells, and if osteoarthritis is part of the metabolic syndrome, hey, this is starting to make a coherent overall picture. Oh, did I forget something? Yeah, I did. Here's what I forgot. In studies in experimental animals who are genetically engineered to get the same version of Alzheimer's disease that humans get, yes, a little mouse genetically engineered to get human Alzheimer's, and if I were the mouse, I would bite the researcher, wouldn't you? All right, well, these mice, when they develop Alzheimer's and can no longer run the maze, that's how you can tell if a mouse has Alzheimer's. It can't run the maze and get lunch anymore. These mice, when they were given the equivalent dose of niacinamide that humans take for their osteoarthritis, these mice had their Alzheimer's disease symptoms reversed. Have you heard that the American Diabetes Association is calling Alzheimer's disease diabetes of the brain? Oh, niacinamide, it'll fix my joints. That's part of metabolic syndrome, having osteoarthritis. It'll fix up my mitochondrial molecule called NADH. It'll help my pancreatic islet cells, and it will, oh my gosh, in experimental animals, reverse Alzheimer's. And I took it just because I was getting osteoarthritis? Looks like it's a basic vitamin for osteoarthritis, doesn't it? Because it affects all the way through the metabolic syndrome into type 2 diabetes and Alzheimer's. All right. So, niacinamide is available at your local health food store, the Tahoma Clinic Dispensary, online or in person, or at your compounding pharmacy in 1,000 milligram capsules, 500 milligram tablets, and 1,500 time-release tablets. Maybe they're capsules, but 1,500 milligram time release. Now, I mention all those different amounts because the amount that's needed for osteoarthritis that I've had people use for years, since I read this book in 1970-something, it was published in 1949, has been 1,000 milligrams 3 times a day. And isn't it interesting that the researchers from the University of California at Irvine found that they needed to give the mice on a weight equivalent, and what I mean by that is if we multiply a mouse's weight to a people's weight and multiply the mouse dose to a people's dose, it comes out to 3 grams a day. Very interesting. And that reversed, I did say reversed, Alzheimer's in mice. And there's every reason to expect it would happen in humans, and there are big trials going on about that right now in both the UK and at the University of California at Irvine. Of course, they won't be done for a number of years. All right, so back to the dose for osteoarthritis. It's 1,000 milligrams 3 times a day. That's what Dr. Kaufman was doing by the end of his research. He started with lower doses and worked up. All right, so you can take 1 capsule 3 times a day. He says it works better if you spread it into different doses and don't take it all at once. Or you can take 2 of the 500 milligram capsules 3 times a day. 500 milligram tablets, excuse me. Or if you're a guy, because it's a big one, you can swallow the 1,500 milligram twice a day. Many ladies have told me, I have trouble swallowing that big pill. I think I'll go with the 1,000 milligrams thrice daily. Most of the guys say, oh, gee, I don't have time to take it 3 times a day. I think I'll take it twice a day, and they do just fine, thank you. All right, I worked with a gentleman one time who came limping into the clinic with a crutch, carrying x-rays. He had arthritis in his knee, and he told me, my orthopedic surgeon says I have bone-on-bone arthritis in my knee, and it's hurting, and I'm needing this crutch, and I'm going to need knee joint replacement, and I hate the idea of surgery. What else can I do? So I told him about Dr. Kaufman, and please consider trying 1,000 milligrams 3 times a day. This was before the time-release capsule was available. I didn't hear from the man for 6 months. He came back walking down the hall with no crutch, not limping along. He says, my orthopedic surgeon can't believe it. I've got no pain in my knees anymore, particularly that bad one which he was talking about replacing. But he says my X-ray is bone on bone, but it doesn't hurt. So I don't think I have to have surgery, do I? I looked at him and said, well, hey, if it isn't hurting, I don't think you do. Well, he was in his 70s. He died 10 years later in his 80s, and he was still using his niacinamide and still had knee joint replacement surgery. You can do that, folks. You can prevent having to go through knee joint or hip joint replacement surgery. You take your niacinamide. It would be a good idea if you get checked for prediabetes, because remember, 80% of the time, osteoarthritis is part of the metabolic syndrome, which leads to type 2 diabetes. And some of the researchers have pointed out that if we get the osteoarthritis in our 40s, it's not 80% anymore, it's almost 100% that we're pre-diabetic. All right, back to the basics. If you have early, middling, or even advanced osteoarthritis, there's an excellent chance if you take your niacinamide, 1,000 milligrams 3 times a day or 1,500 milligrams twice a day, and you wait 3 or 4 weeks, the pain will start to go. And by 3 or 4 months, it will be gone. And as long as you continue your niacinamide, it will stay gone. And I did say an excellent chance. Now, there are 10% or less who tell me that they have most of their pain gone, but not all of it. So they've gone and gotten some of the other remedies for osteoarthritis, and that finished it off. So there we are, folks, the basic vitamin for osteoarthritis. And the reason it's so basic, you just heard about all the other implications of the problem. Thank you for watching and listening.